There's a story behind them. Let's talk about this later.
We have 3 floors. Here we do acupuncture, moxibustion, we do cupping, and in the first floor we have.
Okay, thank you. 我先给大家先介绍一下哈，刚才索里医生告诉我说，他曾经在中国学习。
Let me introduce you. He has learned TCM in China, and mostly do acupunctures and some other treatments of TCM, but it also has other comprehensive measures on treatments. We will see those later.
We have here the map of meridian about TCM acupuncture. We have the meridian and this point of acupuncture.
这是我们中医的一个传统的穴位图哈。
This is a
there is
meridian map.
61 points, which we know, but in China there is more. Each point can treat each disease. So we can select some points to treat headache, migraine, obesity, pain.
Okay, merci. 就是在可以看到，有300多个穴位，按照中医的理论呢，
We can see from this picture there are over 300 meridians, and every acupoint can mitigate ailments, high pressures, and migraines.
This is for acupuncture, for chinju.
这一间房间主要就是用作针灸用的啊。
This room is mainly for acupuncture.
This kind of single-use needles, sterilized.
This is a one-time needle for acupuncture.
Needles. There is a short, the long, many kinds.
这个针也有很多的种类啊，有长的，有短的。
There are many kinds of the needles, short ones and long ones.
Diagnosis after did the diagnosis, we choose which point we can do, and then we do acupuncture. Then we can use electric stimulation like this.
Electric stimulation.
Electric stimulation.
这个就是用等于是一种电击的这种刺激。
Electric stimulation.
就等于是他把这个针就是扎好了，放在病人的身上之后呢，放上一个这个东西，它就是应该可以。
It's after the needles are applied to the patient's skin, the electrical stimulation can be placed upon human bodies.
The point with the laser. This is laser. If we need to stimulate for a baby or for another person who can't use the needles, we can stimulate.
Afraid of the needles.
Afraid, we can use this laser to stimulate like this point, like this, for exactly point. Or
这个呢是一个就是
this
光原理的，就是我们传统的疗程。刚才索里医生呢也介绍，对于一些特殊的病人啊，包括小孩啊。
different from the traditional needles. For special patients like babies, they cannot be feeling afraid because they can't see the actual needles. It's very convenient for the treatment.
Use this one for large zone. If we need to make here or on the knee, we use this one, like this.
Okay, we can go to other rooms.
We can also here use the.
这个大家应该比较熟悉，这个是我们的火罐。
We should be familiar with this. This is cupping therapy.
这是我们就是大家这个应该知道哈，这是我们的火罐。
We should know about this. This is the traditional cupping therapy.
Massage, tuna massage, laser, moxibustion, infrared, and TNS.
就是这张纸上，你看他我就说了，所里医生他针灸是专业学习过的，然后呢还有很多这些传统的一些方式。
This doctor has learned professionally about acupuncture, and now we have massages and moxibustion. He has other approaches to treat the ailments.
Yes, we can use with the fire. I can show you.
Yes, you can show us. 刚才也是在直播的过程中哈，我们有那个网友也提出来说，
In the process,
看他刚
we
才用
have
的是一个比较简单的
netizens
方法，有网友也
posing
问我说
questions
他会不会用
because we saw that he's using this simple way
现在他说他能
of cupping, and we have been asking that can he really use the traditional cupping with actual fire? So I'll be the experiment lab rat
大家稍等
and try this.
所里医生准备一下。
Please wait for a moment for his preparations.
Small zone. We can use this on big zone. It's
He's using himself as a lab rat.
paralysis. We can use flash cupping. This is one.
他说还可以在就是脸上，对于有一
He
些
can-
面瘫的一些患者，也会有缓解和治疗的作用。
He can use it
Merci.
on the faces for patients who have facial problems.
This is also we do acupuncture and we have small
Such as
needles.
paralysis
small
This is
needles.
on
small
face.
needles,
这是一些小的一些针。
very small.
These
What's
are
this for?
small
This is
needles,
for,
very tiny.
auricular acupuncture.
啊
Auricular acupuncture. Auricular is like a baby in the her mother. It's the same form. So we can treat all the whole body with needles in the auricular acupoint.
这个针就是专门是在耳部的这个部位扎的一种特
This
殊
is
的
for
针但是就是说，据说周围的
auricular
也可以治疗就是全身很多地方啊。
and these meridians around the ears can really treat a lot of ailments all over the body. It's a traditional
Needles.
catalog under TCM.
我们这个穴位，
After inserting needles, we can stimulate.
After
it.
inserted.
After ins-
This? And this, what's this for?
This is,
Uh-huh.
like we say,
Mm.
this is auricular,
Mhm.
and it's like a baby in her mother.
Mm.
So here the colon organs, and we can use like this technically. If we have knee pain, this is point of knee. We can
这个点盖
Like
疼，
this.
我们可能就能这个点啊。
So if we have pain in our knees, you can put acupuncture needles into that exact acupoint.
Someone in Chinese and English. No many books in French.
所以索里医生给我们介绍，大家可以看到啊，在他的这个书柜里有很多关于
This doctor has introduced the books about TCM. Some are about there are the French books on TCM are very few. So French translators, please consider this assimilating and decimating our knowledge on TCM.
The diagnosis with the tongue. You know, in China, we can do diagnosis with the tongue. Many type of the tongues, and each disease have a picture of tongue. So we can make a diagnosis by this way. And we can also do diagnosis by taking pulse, Chinese pulse. Okay.
这个也真的是很刷新我的认识。我之前就只是知道可以简单的通过看舌苔的一些颜色或者什么。
Before I only knew that we can see the color of our tongues and then get to see the digestive problems. And this book is about diagnosis with tongues. You can understand a lot of bodily ailments from seeing one's tongue. And Dr. Sari has mentioned the traditional way for TCM of feeling the pulse. And we can see that there are other books on acupunctures for diabetes and some plastic surgery books. Perhaps if I stand this way. Acupuncture for dermatologies. For acupuncture for pediatrics. This is very common for spondylosis.
From China. Yes. And those one are gifts from chief.
他有很多书籍是索里医生曾经去2次去中国学习。
A lot of books are brought by Dr. Sari from China, and some Chinese friends had given these books to him as gifts.
It's inserting needle in the scalp.
我们这叫实用头针血线手册，就是通过
This
在头上
book is about scalp acupuncture. We put needles on acupoints on our scalps to treat ailments and diseases.
Central disease, like hemiplegia, apoplexia.
所以法呢，就是这种诊疗的方式，对一些特殊的病呢，我们还是有很好的一个。
It has a positive effect on some special diseases.
This is I just introduce this one. This is is which disease. So we can it's points when hot is enter. We can it's comfortable and can treat some disease. Many disease. Facial paralysis, back pain, cervical pain, many disease.
提到我本来说我们要去楼上看一下，然后这个提到这个中医的这些方式哈。
I wanted to go upstairs And I mentioned the approaches of TCM. He is very enthusiastic. He introduced the Masturbation approaches for back pain and other diseases. We can introduce to you about the patient rooms. It's on the first floor of the whole clinic. We have another 2 stories. Some assistant approaches on treatments. We may have a few seconds of signal loss. Please wait for a few seconds if the signal is lost.
好，我们现在呢是在突尼斯的监督拜的一个中医诊所，这个中医诊所就是我旁边。
Now we're in a TCM clinic in Tunisian, and it's opened by Dr. Sori. We have introduced the first story of the clinic. The traditional ways of TCM, Tcm Acupuncture, massage, and cupping therapy. The second and third stories are the assistance approaches for treatments. It has gained popularities locally and attracted a lot of patients from home and abroad. The specific operation situation will be introduced later.
Did you feel something smell something when you enter?
Yes. 这个是我刚才说了，这个地方主要是一个放松，一个辅助治疗。
As I said before, this is a relaxed place. He told me that it's a reception room. He asked me if I smelled something special.
How do you find it?
A special scent.
I find just exciting.
Yes, exactly. Here we do. It's like a Chinese concept. Just the tourist when he come here, here 5 senses is stimulated. First, he smells something good. It's like the forêt, it's like the eucalyptus, some essential oil.
所以呢，索里医生向我们介绍，这也是中医，就是中国的传统医学。
So Dr. Sora has introduced to us that this is a Chinese concept on TCM to mitigate the ailments and pain from diseases. You have 5 stimulation for your senses. The first one is sense. You can feel relaxed once you smell this scent.
Music. This is the second sense.
索里医生给我们介绍呢，就是第2重放松的方式呢，是通过听觉。他的诊所呢，
For the second sense is to listen. It usually plays some traditional Zen Chinese music, but it's turned down because we were afraid it would affect our live streaming.
Multicolor light. This the third sense.
也可以麻烦我们摄像老师给大家看一下。刚才索里医生呢就说，他们还会对进行一些视觉的刺激，所以我们进来之后可以感觉到这个。
They also have visual stimulation. we are feeling by the color of the walls. And here, the lightings, he hopes it gives a stimulation on our vision.
There is stimulation of the four sense.
第四重的这个刺激呢，就是我们触觉的这
The
样一个刺
fourth
激。他说，不管是
stimulation
通过按摩
is to our skins
自行这个身体上的
through massages,
Finally, when we finish, we can give
and we can relax by this way.
Chinese tea. This is the final 5 sense. We can give some Moli Hua Cha.
啊，茉莉花茶
Moli Hua Cha.
，It's okay 。索里医生向我们介绍呢，就是说最后的一重就是关于味觉的这个刺激，在放松
The
啊，
last
在治疗之后
stimulation
呢
is about our taste. After relaxation and treatment,
这个味觉的刺激，他们会给一些这个来
there's some stimulation to our taste buds.
中国的茶叶啊，刚才这个是
They would make some Chinese tea for the patients or customers.
And there's another floor right there.
This one is the second floor. We can the patient if he come, he can take her clothes here. Then this is the humid dry zone. There is vaporium, sauna.
So
You want the water?
it's okay. 这个
Just from
it's okay. 这块儿里面我们就不进去了。这里面是一个就是做桑拿的地
We
方。
won't go in
其
there.
实
It's a sauna room.
这边是做按摩的地方，其实可以给大家介绍一下。
This room is for massages.
像这个
We can introduce that,
洗浴啊，还有
for example, the traditional shower for Arab and sauna,
的一些放松的方式，我们可以都看到。
be it local or abroad,
只要
we can see the ways of relaxation here.
诊所
As long as it helps with the patients, he can use it.
many kinds of tuna massage, Chinese massage.
这里面就是分了很多类别的关于推拿放松啊，能够
Here is specifically classified.
一个专业的治疗的一个。
It's all kinds of massages to heal the diseases.
前面吧。Up to you.我们可以看到，and what's this floor?
This floor is
We can
to
see
complete
that
our treatment. If, for example, we need to treat obesity, we do acupuncture, we do chenju, then massage, then sport, education, physical education. It's for education, relaxation. We have ping pong, we have hammock, and we have for some exercise to lose obesity.
好，可以给大家介绍一下哈。首先，别的我们不多说，我们可以看一下这个乒乓球。
first, without further ado, let's take a look at this ping pong table.
300多个中国人。
As I said before,
这也是
there are just above 300 Chinese people. I think this is one of the only few
主要是
of a
为了放
ping pong table here.
进行一些
This floor
比如说有一
is
些
for
健康的表演
relaxation.
不管是在进行针灸啊、按摩啊之后，
For obesity patients. After the acupuncture and massages, they are provided with a place to do sports. And for other patients, maybe they have ailments in their shoulders or arms, it's also a place for them to relax their bodies. People are being treated inside. In consideration of their privacy, we won't go in there.
How many customers here? How many patients here? More people?
More people. Every day, each day, we have sometimes many patients, sometimes no patient. Because we have only 1 year from beginning. The most patients come here for two things. They have pain, disease, or for relaxing, for wellness, for sport, exercise.
所以孙立医生也是给我们介绍，刚开始其实病人很少，没有病人。
He said that there are very few patients at the beginning, and now there are more and more patients. All the patients here have two purposes. The first one is to treat their diseases by TCM. The second is to relax for their wellness. They do exercise and sport here.
She was here when we beginning our activity.
这个时间，17年2月26号呢，就是这个诊所。
They started the clinic in 2017, February the 26th. And our team leader, also witnessed the opening of this clinic. About the stories between this clinic and our Chinese doctors, we'll talk about that later.
Now you can introduce us your study experience. Then I have a question for you. How do you know about the Chinese traditional?
Okay. The first time I found through internet that if we do acupuncture, it is more effective and no side effect. So I many research. I do many research. Then I found that it is a master degree in the University of Medicine in Tunisia, Tunis. So I do inscription.
所里医生告诉我呢，他以前呢是一个其他。
He told us he used to be a doctor in other departments. There are some patients, they have ailments that can't be properly and completely treated by Western medicine. There's side effects. And after he's done his research, he found that TCM can heal his patients quicker and more effectively. And he did a little bit of research. We had a acupuncture center to learn about acupuncture here in Tunis, and he learned that he can learn some approaches.
My professor was Professor Xu. He liked me and I like him. So when he found that I have like gifts for acupuncture, he do inscription for me with the cultural club in the China embassy. Then I go to China the first time in 2010. I studied for 3 months for advanced degree. Then I have a certificate in this advanced degree, the first one, in 2010. Then
所里医生呢，在这里也提起到了一位对他非常重要的一个老师，因为
He mentioned a very important professor of his. because the first time he was exposed to TCM was in the acupuncture center in Tunis. It's a medical assistance mission China has for Tunis. They opened clinics and programs for doctors who already had certificates in medicine. These doctors would come in the center for acupuncture study. And in this center, he got to know his teacher, Dr. Xu Jie. Dr. Xu Jie thought Dr. Sori was very talented at this, and he introduced him to study abroad in China in 2010. The two later experiences of advanced training in China is also a part of cooperative programs for foreign doctors to learn about knowledge more systematically about TCM.
In China, in Nanjing.
看大家可以看到，突尼斯所里医生自2011年9月至2011年12月
We can see
在南京中医药大学
from 2011, September the 5th to December the 2nd, he attended the 240 training programs. It was already 240 training programs, and we believe that these cooperative programs have groomed many local doctors.
In December and January 2018. It was in Jiangxi, province of Jiangxi, in Nanchang. We do acupuncture and essential moxibustion. This is a new technique in China, and this is advanced course. It's a high level, and we appreciate to treat many diseases with the new technique of moxibustion. There is some points sensitive of the heart. So I study for 2 months in Nanchang and have an exam and have this certificate.
这是那个所里医生第2次去中国学习。
This is his second trip for advanced training, and this is the certificate he had. The first time he was learning about acupuncture, and the second time he learned more professionally on acupuncture and moxibustion.
Yes, I have Dr. Shi, met Dr. Shi in Jiangxi, the TCM hospital, and I was very happy because it is my master. So we can speak with her easily because he speaks French. I know him from many years, and it is very exciting experience.
刚才我问所里医生，就是在他去江西学习的时候，
I asked him
他又
if
碰到了这个
he had
许医生
seen Professor Xu again in Jiangxi for his advanced trainings. Dr. Xu has taught him a lot of things on TCM. We can sense that Dr. Sori is very shows gratitude towards Dr. Xu for giving him the confidence in TCM.
And maybe you can ask her for suggestion.
Yes, sometimes we have difficult case, so I send him email to ask something, and last time I just communicate with WeChat.
Oh, WeChat.
With him, yes, with Professor Xu. I ask him if I can share my knowledge with the new student in Tunisia for TCM.
所里医生向我介绍啊，就是许医生呢，
He told
他
me
现在还有保持一些联系。
Dr. Xu is keeping in touch with him right now. If Dr. Sori has difficult problems, he would still seek help through email or WeChat from Dr. Xu. Here, I want to share with you.
能不能麻烦请我们的翻译老师帮我看一看，这是他最近和许医生联系的这个记录，主要是能帮我看他
This
是
is
在
a
问诊
recent
一些什么样的
chat history of him and Dr. Xu.
大家好，Bonjour Monsieur Dr. Soli。在这个我看到的这个聊天记录当中，索里医生
The chat history that I am seeing right now, I can see that Dr. Sori and Dr. Xu are keeping in close touch.
关于一些平常他在中医方面的问题呢，他都会去请跟徐医生，咱们的徐医生。
It's about the daily problems he met on TCM. The latest chat history
最近一次他跟徐医生沟通。
is
关于那个他想要去参与我们，大家都知道我们那个医疗队的针灸中心在这边都有。
about he intended to attend our training programs because of his own special experiences. He wanted to join the training team and help others.
在突尼斯市依旧有这个针灸中心。
The medical teams
中医的这个
from China,
培训班。
we are still organizing new training programs, and Dr. Sori wants to be in on the program to help the local students better communicate with Chinese doctors.
Yes, it's interesting. If we can, if the university accept, it is good to share my experience with a new student because I have several years of experience to insert, to choose point, to localize point, then to insert point. It is very effective. So, when we study here in Tunisia, we only know short things. But my big interest is because I am going to China. So there in China, I understand many things and can do many things.
所里医生也告诉我呢，他愿意参与到这个。
He also told me that he would like to attend these programs to be a volunteer to help Tunisian and Chinese doctors to communicate better and to help the local doctors to gain interest, because what we're exposed to at this training program is very limited. He also would like to share his experiences he's had during his 2 trips to China. If he can volunteer at the training center, our on-site guest can make the decision. Here we have team leader Xie, Dr. Xie, and you have also heard that Dr. Sori wants to join us as a volunteer. What do you think of it? It's very good. It's as a local doctor. He has learned about TCM and acupuncture, and he's using his own experiences to disseminate TCM information for local doctors, and he's played an exemplary role. We've talked about much about Dr. Sori and the clinic. And we also know that this special situation, which is we don't have too many Chinese nationals here in Tunisia. So why is TCM so popular in the locals? Is it because of our Chinese local Chinese medical teams? We have started to send doctors to Tunisia from 1976, that June, and we have 22 batches of doctors stationed in Tunis. And this fresh batch of doctors, they're stationed in 4 places in Tunisia, and we have a total of 41 doctors. There are 5 acupuncturists. So these medics, as we mentioned before, they are the major voice of the acupuncture center. Our center started in 1994. From 1973, there were scattered team members who started acupuncture therapies in Tunisia. From 1973 to 1992, these 2 decades have publicized the treatments of acupuncture, and the patients are talking with each other about the effectiveness of acupuncture. And to answer for the invitation of the president's wife, the center was established. Afterwards, we have made cooperations with the Tunisian hospitals, and we have employed physicians to learn acupuncture in our center. There are over 116 local doctors who have learned acupuncture, and Dr. Sori is one of them. The effect is very positive. Like Dr. Sori, he has his own TCM practice. His patients are from all over the country or other countries, maybe even in Algeria and France. According to the features of TCM, we want to because the medical facilities and the levels are promoting in Tunisia, we want to exert an effect from in TCM. So Tunisia is different from other African countries. It's not the classical lack of medical supplies country, and that's why our medical teams are publicizing the effectiveness of acupuncture. The economy of Tunisia is above average in Africa. A lot of their doctors have studied abroad from Germany or France. Their medical skills are elevated, evidently. And the numbers of doctors and the number of doctors is needed less. Traditionally, we send Chinese doctors here. If we focus on our TCM and publicize our Chinese culture and traditional theories on TCM, and we already have 4 decades of history on this, so from here onwards, we may have better developments. In the future, we will make the acupuncture center a better one. Now, we want to elevate it as a TCM center from last year on. We are promoting our clinic by several measures. We have asked 8 local acupuncturists to further training in China, Jiangxi province, university focused on TCM. And we have also organized events on TCM here. It's a very good form to disseminate the Chinese medicine's ideas. We have organized local doctors to visit in Jiangxi province, in some Chinese medicine factories and training programs. They could learn experience from the whole experience of TCM. Dr. Xie has introduced a lot of ideologies for these last 2 years. You have mentioned that the acupuncture center is going to be upgraded into a TCM center. I believe this change is not merely a change of words, because we have concrete plans. If there is any, please tell us a little bit about it. TCM Center obviously focuses on traditional Chinese medicine. We have been doing this work for over 20 years. We are upgrading the service scope and the medical skills of TCM. We have masturbation right now, also cupping therapy, and some gynecology, pediatrics, and internal surgery to add different departments into the center. Before there was only acupuncture department. Now we have more specific classified departments. Apart from this, we have also other explorations in plan. We also have Chinese medicine. The raw materials of Chinese medicine are actually plants, and from this perspective, we are cooperating with Tunisia. We are discovering the plants which can be used as medicines. They are green plants that can be introduced into Tunisia. If Chinese medicine can knock open the door of Tunisia, we can obviously do better. I wish you a success transformation from this acupuncture center to TCM Center. We are looking forward to all this. We have talked about a lot. I believe that from the beginning, our live streaming audience have a question about how proficient is Dr. Sori. Is his approaches effectively treating patients? Generally, Many of us are strange to the idea of acupuncture. Can it really treat diseases? And how is the effect? We have another problem. I have a little bit of ailment of myself. Please, translator, help me to tell him about my ailment. I wasn't feeling very comfortable in my gallbladder, and I would sometimes feel very painful. And I went to the hospital to take a B ultrasound. There was no inflammation or gallstone. It's just the growth of my gallbladder is abnormal, and it causes some pains. But there's not a good way to treat this, because you can't really perform an operation for this problem. I have asked medics from China in Tcm, and he told me it is unrealistic to perform acupuncture. But he told me about this acupoint. Dr. Sori doesn't understand Chinese, so we can speak freely. This acupoint is on the lower half of my calf. And this doctor told me you can massage by hand or other objects on this acupoint. It will help you. It will help you mitigate the ailment in your calf, in your gallbladder. Now, please tell Dr. Sori about my problem. If he can identify this acupoint on my calf, then I think he's really experienced. You can explain this problem to Dr. Sori.
Il vous demande une consultation et il a dit il a un problème sur au vésicule biliaire et il a dit il est allé à l'hôpital pour voir le radiologue et il a fait le scanner et on n'a pas trouvé de calcul et on n'a pas trouvé des autres grands problèmes. Et aussi, il est allé voir les acupuncteurs, les médecins traditionnels chinois en Chine. Et les docteurs, on a dit c'est presque impossible pour faire l'acupuncture. Parce que notre journaliste, il travaille à l'étranger, c'est pas travailler en Chine. Donc, le docteur chinois, il a proposé de taper quelques points lui-même à la maison, mais donc maintenant, et aussi il est allé voir le médecin occidental, mais on ne peut pas trouver une bonne solution. Donc, il veut vous demander, est-ce que vous pouvez lui donner des conseils sur la médecine traditionnelle chinoise?
Oui, bien sûr, je peux nous donner. Seulement, je veux lui poser quelques questions. I want to ask him some questions.
他要问我一些问题，那
He wants to ask me some questions. Okay.
I can use the translator.
OK，it's OK， 因为涉及到比较专业的一些术语哈，所以他用一下这个翻译。
Because of the professional terms, he wants to use the translator.
I know this. 他在向我问好。
How many times did you have this pain?
He's saying hi to me.
Each day or one week or how?
就是他问我一周会有几次
He asked me how frequent I'm having this pain.
Est-ce que tu as de la fièvre accompagnée ou non?
可以给。No.
We can see this. Do you have a fever?
Ok. Est-ce qu'il y a des irradiations, des douleurs ou c'est localisé ici?
他问的是这个疼痛的情况具体是什么样？
就是吃了油腻的食物会比较。
What's the specific situation of this pain? I would feel more painful when I eat some oily food.
Donc, premièrement, il doit faire une bonne hygiène diététique.
首先呢，您应该是要先做一个节食，在饮食方面有一些
First,
调整。
这个中国医生跟我说了，说就是少吃
you
油腻
need
的食物。
to have an adjustment in your diet. The Chinese doctor also told me to stay off the oily food.
要对少吃油腻的食物，然后要尽量多吃蔬菜水果这样子。
Stay off the oily food and eat more vegetables and fruits.
另外他还提到一个，就是要合理的控制情绪，要少生气。
And he
这
mentioned
个也是伤我们的。
you need to manage your emotions.
这一点
And
我可能
you
做得不
you
是特别
can't
好
be
以后
always
要
mad
对要注意
because it hurts your gallbladder to have emotional surges. This I am not doing this very well. I am not a very good anger
这
manager.
这个位置扎针，这个位置是跟我们的胆囊相连的。
The needle can goes into the acupoints on your head. It connects to the gallbladder, and also massages are okay.
Fois 13 et fois 14, c'est ici. Fois 13 et fois 14.
这个位置是肝13，这个位置肝14，我们也是要进行一个针灸扎针。
Here are the two acupoints. We can also insert needles there.
这个地方也是，这下面还有这两个点也是跟那个肝。
Here,
说到了这个地方。
these two acupoints down there are also functional for gallbladder treatment.
就是这个地方，也是中国的中医生跟我说。
I didn't show you before. It's this the acupoint. This is the acupoint that Chinese doctor told me to massage and do acupuncture.
这个位置是他提到是肝3的位置，我们也是要进行一个。
你可以跟他说他找的很准，就是中国。
Also here is a acupoint.
中医生大概
You can tell him that he's very exact, because a very professional Chinese acupuncturist has told me so as well.
And he can give us.
He's the patient here. Hi, bonjour. Bonjour.
English.
English.
He is from Tunisia and he lives in Paris.
I'm going to give you some briefing about me, what I am going to do here. First of all, I come from this region. I am from Jendouba, and I am a patient to my friend and my doctor Isam. I come from France. I am a tour operator in France for tourism and for aeronautical transportation. And here in Tunisia, I have a society for assistance for investors and Congress. And I am here.
So you just live here?
Yes, I live here in France.
I live here in France. Live here for business, right?
Yes, for business and here and there, of course. Before speaking about about me, I am a patient for here. I find technical Chinese technical is very important.
Where you find it? Here or in China?
Here, Jendouba is called and is known from for decennies for technical Chinese here. There is a hospital, big hospital, University Hospital here in Janduba.
Thank you. Allow me some time to translate to Chinese audience.
Yes, as you like.
这位先生呢，刚才就是在我们的直播过程中，他一直坐在这儿。
This guy here, during the live streaming, he was always sitting here and waiting. I thought he was with us, a working personnel, but also he is the patient. He heard about this live streaming because he speaks French and English. He can share his experiences here. He's from French. He's working here in Jandoba, and sometimes he lives here, sometimes he lives in France. And he is also a patient of Dr. Sori. He's an old friend. I asked him how did he get access to TCM in China or in Tunis. He told me that he was exposed to TCM in Tunis. I asked why, because he said because the residents here all knew about the Chinese medical teams and their fine doctors. And the hospital that they stationed were very famous and prestigious, and the locals all knew about it.
There is plenty of doctors coming here since years of 18th, I think. One last
come here in 1970.
Yes, I think exactly. But
yes, first one in 1970.
exactly, I am one student here in Janduba this year.
You were there?
Yes, from here. From there, I was student here in Janduba.
Oh.
Yes, and now I am working plenty of centers of work. But I am going and come back for Janduba because I find what I am looking for my health, and I am going to make a new vision. And I enjoy this occasion to make a call for our friend Chinese, for investors coming from Chinese, to make their hospital of Chinese and Janduba. In this case, it will be a destination for all Maghrebs and all Africans. I am organizing forums for Africa, for Janduba, and Tunisia is a destination for health hospitality. That's why we are going to make this with our friends Chinese, and first of all, before going to other countries and other technicals. That's we are provided of this occasion to make this call, and we are here happy to meet you for this occasion, and we are able to make everything and to facilities for about every formalities and for documents and everything. Thank you very much.
Thank you. 我们这位老师，我们这位患者刚才
This gentleman here told us that he's half local here because when the first batch of Chinese medical teams arrived, he was a student here in Jandoba, and now he's had a career. He has been working for a while, and he's not as young as before. But all those years, the Chinese medical teams are here, and he knows about it, and it's very popular among the locals. The reason why he wants to share his experiences with us and to help publicize for us is that he supports this cause, and he welcomes more Chinese investors to come here to invest in the TCM cause and enterprises.
With me, she helps me, and I would like to felicitate and thanks her.
Okay, and merci, and thank you
very much.
Thank you, merci, thank you. 好，我们今天这个直播的时间也不短了哈。我们索里医生带我们参观
Our
了
live streaming has been not short. Dr. Sori has showed us around his clinic. not only the traditional TCM techniques, but also other supporting approaches. And I asked him to diagnose my personal ailment, and we came to understand that he's very professional at his career, and we're here very glad to have our guest, Dr. Xie, the team leader of our Chinese medical team in the 22nd batch. And we have come to understand the work we had, and we are grateful for this patient who's also here, and we have felt that that TCM is very popular locally. And thank you for your support. That's all for today's live streaming.